So then we were looking at the components of the skin, and then we were looking at the different types of skin that we have, which are thin and thick skin. And then if you look at a magnification of the skin, and you will see the differences between thin and thick skin. Well, you can see that thick skin has greater layers of dead keratinocytes or keratin within the stratum corneum. So all of this is the stratum corneum. And then in here, in thin skin, you have very little stratum corneum. Now, remember that in thick skin we have 5 layers, and in thin skin we have 4. So the only layer that is missing here in thin skin is this, the stratum lucidum, this tiny layer in here. But the other layers are present, so in both, this is the stratum basale. So here is the most internal layer. And then the next one will be the stratum spinosum, which is this. And then the stratum granulosum, which will be this part and this part. And then again, the thicker in both of them will be the stratum corneum, which is the most superficial layer. And then for the components of the dermis. So in the dermis, we not only have loose, elastic connective tissue here and dense, irregular connective tissue here, but also we have blood supply through these capillaries. This is the papillary plexus. And then we have these tactile corpuscles that reaches here these papillae, which are finger-like projections. So these tactile corpuscles help us to detect fine touch or superficial touch. And then we have these lamellated corpuscles that helps to detect deep touch, vibration, and they are located in the reticular layer. So in here, in this histological view, you can see these papillae, and then the fibers of this papillary layer, which is loose connective tissue. So these are collagen fibers, elastic fibers. And then here we have a lamellated corpuscle, and then the blood vessels with this transverse cut that helps you to see here internally where you have the blood, providing oxygen and nutrients to these layers, and by diffusion, this oxygen and nutrients will go into this epidermis. Remember, epidermis is an epithelium, and epithelium doesn't have blood supply of its own. So correspondingly then to these papillae, we have in the epidermis these extensions that are called retipex. They are not labeled in there, and that's not the only structures that we have in the dermal papillae, but that's an example of what you can see. But we will see later on more structures. But these retipex, which will be going downward, so this will be the retipex. Corresponds to these papillae of the dermis. And then last time, we talked about what is the importance of having this arrangement. I mean, it would be very easy to have the epidermis just flat like this, and then on the bottom, the dermis just like this, flat. But there is a problem. You lose surface area. And since you use your skin to manipulate objects in the environment, like when you touch the objects, the dermis can be easily detached from the epidermis if it was for this arrangement. So then you have the papillae from the dermis, and then you have the retipex from the epidermis fitting specifically, increasing the surface area. It's like Velcro. So that creates a stronger connection because you have more area to connect than just flat. So sometimes in anatomy and physiology, we don't know everything because we are doing research. We're trying to find why things are the way they are, but definitely everything in the body, guys, have a purpose, including why the things are like that, why it took longer to assign this epidermis and dermis the way they are. So now our epidermal ridges of the skin, which will be these ones, will be undulations in the structure that basically, if you magnify, this is the longitudinal view, this is like the superficial or surface view of our fingerprints. So if you magnify these epidermal ridges, which are basically projections of the skin, it will have this view, like you have some indentations in between, some ridges here, and then you have pores, sweat pores, through which we sweat, and then we have, at least in the fingerprints, we have a specific pattern that is unique to each of us. But no matter if it's in the fingerprints, these ridges, or if it's in the palm or in the soles, also they have a purpose. The purpose is to create traction so that we can grab objects much easier. And when it comes to plastic bags for the grocery store, since they are here like that tightly, with those fingerprints, you can separate the parts of the plastic. As we age, the skin thins. And then so as our epidermal ridges, and then you have hard trouble separating the plastic bags. Oftentimes I ask someone younger than me, can you do this for me? Because my epidermal ridges, guys, are thin right now. So you're very young, 20, 30 years more, you will know what I mean. Well, 30 plus. Not even 20 here. Okay, now, in our skin, we have orientation of these collagen fibers in many areas that creates a pathway, if you want to see it that way, and these are called the cleavage lines. These cleavage lines are specific in certain areas of the body in the way they orient, and they can be useful for whenever someone is going to have a surgery to make an incision following these lines. The reason for following these lines when it comes to making incisions with a scalpel, it is to prevent breaking these collagen fibers in a transverse way that will prevent these collagen fibers from finding the endings of each other quicker when it's time to heal. If you cut this transversely or cross-section, the tendency of the proteins from the collagen is to pull apart. And then, of course, repairing of these will require to have fibroblasts that comes and bridge collagen fibers, making more protein. However, when you cut parallel to these lines, you will have less scarring and shorter time for repairing. Doctors know this, and they try within the limitations that maybe one surgery or procedure might have, they always try to follow these lines, especially plastic surgeons. Plastic surgeons have to work with these lines in the face when they're doing cosmetic surgery. Why? Well, to prevent scarring. And then also, something that is related to these cleavage lines is that it helps to provide elasticity and strength, of course, with the collagen fibers to our skin. So another name of cleavage lines is known as tension lines. And here you can see the body in the anterior view, and all these blue lines that you see here represents these cleavage lines. Like above the navel area and below the mammary area, the cleavage lines, they run almost horizontal, but they follow like kind of a scallop pattern. And then here, from the abdominal area, from lateral to medial, they run like this direction. And then the thigh area, from lateral to medial, and then the knee area this way. So this arrangement in here will allow for us that when it comes to stretching and elasticity, whenever you sit down, you don't break your collagen fibers because they are oriented in a way where we sit like this. And of course, I mean, the skin itself is very elastic, not that you would break them, but this one creates less tension, this arrangement, because we constantly are sitting down, or maybe as you're doing exercise, okay? And similarly in here, we flex a lot. So that's something to keep in mind. And again, here are some lines in here. So what they show you in this magnification is, for instance, a wound here in this area, in the pectoral area, where they follow these lines, and then the edges of the wound will be closer together after stitching, healing faster with less scarring than if you make a transverse cut here in the thigh area, because these will tend to pull. That's why they are called tension lines. And then see the edges. They tend to not be as close. Any questions? Okay, now let's look at epidermal growth and keratinization. So we have these different layers of the skin, of the epidermis. But the most internal layer, which is the stratum basale, is the one that has these stem cells, the keratinocyte stem cells, which are the most abundant type. We also have melanocytes in that area, but we're talking about the keratinocytes. So then these keratinocytes with the stem cells undergo mitosis when the cells in the surface get flaked off, the stratum corneum. As stratum corneum is flaking off every so often, 7 to 10 days, we get rid of the superficial layers. That signals to the bottom layer, like the stratum basale, to undergo mitosis so that you can create another stem cell of keratinocytes and a daughter cell that will move from the stratum basale to the stratum granulosum. And then to the stratum spinosum, and then they will move into stratum lucidum and then the corneum, if it's thick skin. But always keratinization happens from basal layers to bottom layers. to superficial layers. From deep to superficial, that's the way. And then that process of flaking off the storm corn is called exfoliation. If you don't wear lotion, or even if you wear it, but during winter time, you can easily see that whitish surface in your skin. Well, that's basically very dry skin, and that separates much easier than the deeper layers, of course, that are more moist. And then something that happens as this migration upward happens is that you produce keratin and lipids, and that forms a waterproof layer in our skin. So here is the diagram showing you how this stem cell A undergo mitosis, and then it produces another stem cell which will stay here in the basal layer, but then this daughter cell, which now we'll be calling B, will move from stratum spinosum into granulosum, into lucidum, and into corneum, and it will die, and it will become a keratinocyte, and then it will end up in our bed. Our bed basically it's like a bank out of keratinocytes, dead keratinocytes. So now, what factors influence our skin color? Well, it's the amount of melanin, the type of melanin that we have, and exposure to sunlight. That's the natural skin color, right? So as we expose more to sunlight, the melanocytes produces more the pigment of the skin, which is called melanin. And then we become tan. And then even within the different colors of skin that we as humans has classified, there are also tones, but that's based on the type of melanin that we have. And then the reason why we increase the production of melanin in exposure to sunlight is because sunlight has UV light, which is ultraviolet light. Which is a type of light that has, in terms of wavelength, has certain energy that can, as it's penetrating the skin, produce breakdown in the DNA, or it can produce thymine dimers. So thymine dimers are a type of mutation in the DNA in which you have thymines, or well, let me put it this way, attached to each other, and that changes the code of the DNA. And the person can develop different types of cancer. But one can be, for instance, melanoma of the skin, which is a cancer derived from melanocytes. Now, something else that can affect the skin tone is the presence of pigments like keratin, which is found in carrots, for instance. that can deposit into lipids, and then you can see it's like an orange pigment. And then the oxygenation levels. Whenever someone has excess of oxygen, the person will look reddish, like blush. And then when someone has low levels of oxygen, this is called cyanosis. And then the person will look bluish. Now, there is other things that can make the person to look bluish. And I remember once pointed that at me a long time ago. So, for instance, there can be some diseases in which the person can be maybe having excess of certain metals because the person gets exposed to that, it goes into the bloodstream, and that can lead to also bluish. But when it comes to low levels of oxygen, you can see it. This is known as cyanosis. Let me put bluish tone in skin from poor oxygenation. And then sometimes we can also have deposit of pigments confined to a specific area. That can be birthmark, it can be a freckle, it can be a mole, and that's related to an even distribution of melanocytes. Or sometimes you can have like an area where you don't have as much pigmentation. And that leads to an undertone in your regular tone of skin, no matter if you're fair skin or not. So this is how the synthesis of melanin happens. So if you magnify the stratum basale part of the skin and you see a melanocyte surrounded by some of these keratinocytes, after this melanocyte produces the melanin, which is a protein, it's a pigment, so it will pack it up in little vesicles that we call melanosomes. And these melanosomes will migrate into extensions of the plasma membrane of the melanocyte that goes in between these keratinocytes. And then through exocytosis, these melanosomes will go into the keratinocytes, and then you unpack the melanin, and then these, depending on how much pigment these receive, these cells will become darker. So that's the process. It's shedding melanin through exocytosis. And then the process of these cells bringing in these vesicles with melanin will make the melanin to be absorbed by these cells. What is the opposite of exocytosis? Well, just don't do only endocytosis. So yeah, then melanocytes exocytose and keratinocytes endocytose. So functions of the skin in general, like including epidermis and dermis, plus subcutaneous tissue. It's a barrier. It helps in immune system defense and sensation. Functions of the dermis itself. So epidermis, it's a barrier, acts as immune defense. Function, and then is in sensation. Now, functions of the dermis will be providing strength and elasticity, and also to nourish the epidermis. And houses the blood vessels, nerves, and glands. Subcutaneous tissue is insulating our skin and our body, cushions as well the skin and our body, and provides energy storage because that's where we have adipocytes, we have fat. And that's the area, guys, in our body where we store more fat. Why? Because it's just next to the skin, and remember the skin is having a lot of surface area, so it makes sense that then we have the bank of energy in the subcutaneous tissue. And also helps in thermoregulation, basically controlling the body temperature. Okay. So now let's talk about the accessories. The hair structures first. So the visible part of the hair that is found above the skin is the shaft. And just like our skin, is made of keratinized stratified squamous epithelial cells. Next to the shaft, deeper in the dermis, we have the root. And the root is surrounded by membranes that we call the hair follicle. And at the very bottom part of the hair root, we have the hair papilla, which is basically the area where we have the blood vessels. And then we have a part that is called the matrix, where we have the cells that actually make our hair to grow. What is the function of the hair? Well, it shields areas like the scalp, and it prevents foreign particles from entering into the deeper portions of our body. And kind of indirectly can provide sensation too. So, if we were about to be blindfolded in a room that has an opening to the external environment, and then someone covers our ears that we cannot not hear anything, and then you have your arm without a sleeve, and then they ask you, well, introduce your arm to this hole, and then they would do it for you because you're blindfolded. And then they will ask you, is it windy or not? You will be able to tell because the hair shaft will move like this when it's windy. And you can tell the intensity and the direction of the wind because of that. And of course, we're talking about these moves, and I know that we also have skin receptors that are able to do that, to help us to tell the intensity of the wind, etc., because you can do that also with hairless skin, which is the palm or the sole, and still be able to tell. But this is more intense when you have hair. So then it's a sensory organ. And we actually have, surrounding the root, a plexus, a set of nerves that is called the root hair plexus. I don't know if it's labeled in your image next, but basically that root hair plexus can sense the movement of the shaft, and it can send the information to our brain so that we can make sense. and it's associated with light touch. And you don't need to do that experiment. Like, even if you close your eyes, you blow air in the surface of your skin. I mean, it will tell you that if you have light touch, or even you can do this. Okay, you can rub your skin. And also place a minor thermoregulatory by trapping a layer of air close to the skin. So here is the view of these parts of the hair. So this is the shaft. Again, it's above the skin. And then here we have the root. It's surrounded by this epithelial root sheath and this dermal root sheath, which is basically the hair follicle. All of this is the hair follicle. And then here we have the erectropili muscle that contracts and make our hair shaft to be straight. And then this is what we feel as a goosebump. If you make a section of the shaft, you can see the parts, and not only from the shaft, but also from the root. So this is the central part is the medulla, surrounded by the cortex. And then the most external layer of our hair is the cuticle. And again, these are cells. These are dead keratinocytes. And doesn't have a blood supply, of course, because it's an epithelium. What will happen to us, guys, if this tissue was alive? Every time that you go and have a haircut, it will hurt. You will be ouch, ouch, ouch. And then you will be having such a long hair. So yeah, these are dead keratinocytes. And of course, again, they don't have blood supply because it's an epithelium. Otherwise, imagine every time that we have a haircut, we will bleed, okay? And now, so that's the cross section of the shaft. But now, if you make a section, a frontal or longitudinal section of the root, so this is what it will look like. Again, this is the medulla, this is the cortex, cuticle. The cuticle is surrounded by this epithelial root sheath, all of this, and then the dermal root sheath, which all together, these membranes and all this part makes the hair follicle. And then at the deep part of the root, we have the hair bulb, this part. And in the hair bulb, we have the papilla and the matrix cells, which are this, that makes the hair to grow. And then we have these blood vessels that provides nutrients and then oxygen. And then here we have these melanocytes that give the pigment to our skin. And this is how it looks like in actual microscopy, surrounded by, in this case, adipocytes. Any questions? Now for our nails, just like as hair, they are accessory and they're made of keratinocyte stratified squamous epithelium, again, dead cells. And in the nails, we have this visible part that is called the plate. And then we have the root that is underneath our skin, underneath our cuticle. And that's where we have in the root the cells that makes our nails to grow. And then the matrix will be just similarly as to the root hair matrix. They have cells that are undergoing mitosis so that we have growth of our nails. And then the foldings next to the plate on the sides will be the lateral folds, and then we have a medial fold and a proximal fold. Sometimes in some of our finger tips, we can see like a half-moon-shaped white structure that is called the lunula. That's located next to the base and represent actively growing cells. Functions of our nails: to protect the fingers, the tips of the fingers, and also from the toes, of course. and enhance fine touch manipulation by providing a rigid backing for our fingertips. So you can grasp objects. Any questions so far? Okay. So here is then the view of the nail components. So this broad portion is the plate. Then you have a medial fold medially, a lateral fold laterally, and here we have the eponychium, which is basically a portion of skin that we know as cuticle, colloquially, that protects the nail root, which is underneath this skin. And this is the lunula that represents actively growing cells. And then if you see in this lateral view with the longitudinal section, you can see here this nail root of the plate with the matrix. So this is where we have the cells that makes these nails to grow. And then this is the eponychium. Underneath the free edge of the nail, we have the hyponychium that holds the skin from your fingertips into this free nail edge so that no microbes enters through this area. Not to scare you, and maybe you know already about it, but this is an area of the body where we have a bunch of microbes underneath our nails. So then when someone is going to have a surgery and the doctor starts scrubbing so much this area with the scrubber, the brush, is for a reason, to get rid of as many microbes. And they use, of course, a chemical that get rid of the microbe, but they mechanically get rid of the microbes too. And then, of course, we have here the bone and then the connective tissue, etc. But what happens if you overcut your nails? Like if you go a little bit beyond, you get pain, right? Because you cut your hyponychium. And as it grows, you still feel hurt there. So that's the other accessory. Now let's look at the skin glands, which are also accessories. So we have sweat glands and sebaceous glands. Sweat glands produces sweat, and then sebaceous glands produces sebum. Now, the sweat glands, they have a role. Like we have these eccrine glands that helps in thermoregulation. So basically, what they do, and we have it everywhere in our body, they release this sweat so that we can drop the body temperature. That's the function of these eccrine glands. Now, these eccrine glands are not associated with a sebaceous gland. With the other function of the apocrine glands. Now, the apocrine glands, which are active after puberty, are glands that are located in specific areas, like the axillary area and the inguinal area, the groin area. These ones, they secrete their secretion after puberty, and when these glands they become populated with bacteria, they provide a malodorous type of secretion. And these apocrine glands basically shed their entire secretion into the surface of the skin. Now, for the sebaceous glands, when they secrete the sebum or the oily secretion, it's not only to lubricate the skin and the hair. But also what they do with these fatty acids from the sebum, they decrease the pH, which basically is having more acidity, and that acidity kills microorganisms. So they inhibit bacterial growth. For instance, we have here at the entrance of our ear canal a specialized types of glands that are called the ceruminous glands. These produce the earwax, and that earwax prevents the growth of microbes in this ear area. And then I told you this before, but the mammary gland is a modified sweat gland. And this one is specialized to produce milk during lactation. We know that it's part of the integumentary system, but when we start studying the reproductive system, we will consider it there because it's helping to nourish the baby. So here are some examples then of sweat glands. In this case, this is an eccrine gland, which, if you remember, they have merocrine secretion, which is basically releasing the sweat directly into the duct. So they are made of simple cuboidal epithelium or stratified columnar epithelium. So here is the sweat gland in the dermis. So this is an eccrine sweat gland. And then we have these sebaceous glands that are associated with the hair cells, with the hair. So in this case, if you magnify it, you can see that it is tubular acinin. And then these undergo holocrine secretion because they rupture the cells and they release their contents, and then you replace these cells. So they release the sebum into these shafts. And then the apocrine, which are similar in secretion to the eccrine, so they have merocrine secretion. These apocrine glands will be located in these areas of the body, in the axillary area and the groin area, and they release the sweat. And again, if these ones, they become populated with microbes, they become malodorous. Any questions? So then what is the role of the integumentary system in maintaining homeostasis or dynamic equilibrium? Well, one way is by helping us to maintain body temperature so that we don't have high body temperature or low body temperature. We maintain it at 37 degrees Celsius with a variation of -5 + 5 degrees Celsius, which is 37 is 98.6 Fahrenheit. So then, during winter days, when the outside body temperature is colder than your body temperature, well, you try to decrease the loss of heat to the environment. And one way to do that is by reducing the blood flow to your skin. When you reduce your blood flow to the skin, there is less heat in the surface of your skin, in the surface of your body, and thus the heat is not lost into the environment. So then you preserve the core body temperature. So you have something that's called vasoconstriction. You reduce that blood flow. But then let's say that summer days are coming, and then the temperature outside of your body is starting to increase. In that case, you don't want to absorb heat. So one way to do that is by increasing the blood flow in your skin, so your blood vessels become more visible in your skin. And that means that you are dissipating heat to the environment. And not only that, but you also will have changes in behavior that includes removing excess of clothing and then drinking more water so you can restore your normal body temperature. you can reduce it. And then our environment is dry, so we try to preserve water by having this keratin in our skin and secreting lipids. And then also we have interaction with the nervous and cardiovascular centers. So, I mean, how do we regulate this body temperature? How do we increase and decrease the the blood flow to the skin? Well, by sending signals between the skin and the cardiovascular center to increase or decrease the blood flow. And then with the nervous system, well, we have thermoreceptors in our skin and pain receptors that tells us when an object is hot or is cold. And then we can set a response with the nervous system. We will see that later when we talk about reflexes in the nervous system chapter. So here's the cycle for thermoregulation. So in this case, we have about a temperature of 37.2 degrees. And then if that goes higher, then that signals goes from the skin into the hypothalamus, which is this part of the brain. This is the brain, so this is the mid view of the brain. So then your hypothalamus receives this signal from the thermoreceptors from our skin, and then you start increasing the blood flow. More blood goes through here, and then that carries heat, and the heat will be going from the dermis into the epidermis and then into the environment by diffusion. And then you start also increasing the production of sweat, so you start sweating. Once you go back to 37.2, then your blood vessels return to normal. So you don't have as much blood flow. So that's during high temperature. Now, what about when you have low temperature? So now let's move from 37.2 to 36.1. Well, in this case, just similarly as before, we have thermoreceptors in the skin that can tell when temperature is high or low. In this case, it's low, 36.1. Then you send with these sensory receptors a signal into the brain to the hypothalamus, so that you will send a signal into your blood vessels so you don't have as much blood supply. This is called vasoconstriction, and then you don't dissipate any heat. And as well, you start behavioral changes like, well, it's called, if there's a source of heat, you will get nearby to that source of heat. And if you have a jacket or something like a sweater, you put it on so that you don't lose as much heat. So those are normal responses that we have in our body and in our behavior. Okay, so now for the skin, I think I mentioned this to you before, but we have burns that are classified as first, second, and third degree, and that depends on how much extension of the burn happened in your skin. Like first degree is the less severe, it only covers the epidermis, and in this case it's superficial, so impacting here, so you won't have major problems. The only thing that it can happen, like if you overexpose yourself to natural sunlight and then you become reddish, the only thing major thing that I can see happening is that you will have pain, but no more than that. Now, second degree goes beyond the epidermis. It goes from epidermis up to the dermis. And in this case, you will develop blisters. The blisters can rupture or not. More than likely, you will end up rupturing them. But one thing to take care from these second degree burns is that you prevent these to get infected. So you cover these lesions and then you put some antibiotic, or you can wash it. But if you expose it before it repairs, more than likely microorganisms will come and then can infect your skin. In third degree, what we will have, it is going from epidermis, that's the burn, to dermis, and then beyond. Like it can go into hypodermis, muscles, into sometimes into bone. And in this case, you will lose all the structures of the dermis. So that will be including hair follicles. Hair follicles can be pulled from the lesion, and as well you will lose the nerves. The person will feel pain around that area that is damaged, of course. But if someone was cleaning that area, specifically getting rid of the debris, that person won't have any pain. You don't need anesthetics in that case. Major problem in here is that you lose liquids, you lose fluids. And there are formulas that tells you, based on percentage of area affected and the depthness, is how much fluids the person requires, and don't think that they put it all at once. No, it has to be little by little. And the treatment of this will be at the hospital. Third degrees cannot be treated externally. Another problem, it is actually having skin cancers. So exposure to UV light is a major risk, and then depending on the skin cancer is the prognosis and the treatment. So here we have an example of first degree burn, just reddishness, only affect the epidermis. Second degree affects these two layers, epidermis and dermis, create blisters. And then third degree, everything down up to hypodermis or deeper tissues. So for burns, for calculating the surface area, third degree burns, you use the rule of nines. So in the rule of nines, you calculate the total body surface area, or TBSA, affected. So we divide the body into regions that represents 9% each, or a multiple of 9. So you want to use this to guide treatment decisions and fluid resuscitation, and that can give a prognosis. Sometimes some people, they have so much area affected that they die, unfortunately. Burns involving greater than 20% or critical areas like the face, hands, genitals, the feet, they require within these hospitals more special care. Something that happens in these hospitals is like they double filter the air in the environment, because the person can easily get infections in the skin, in their body. And then they apply topical ointments, like for instance based in silver, that helps them also to prevent infections. And they have to be covering these areas as well, because the body can keep losing fluids through these wounds. Something for sure, that if the person survives and if it's possible, this requires, as part of the treatment, grafts of skin. And the grafts of skin sometimes come from the same person, most of the times. Okay? So these are called autografts. So let's look at how the division of the body looks like. So in the case of the head, the entire head is 9%, 4.5 anterior, 4.5 posterior. The body anteriorly, it's like, again, it's a multiple of 9. The torso and the abdominal area, 18%, front, back. And then the arm the upper limb, sorry, it's 4.5 the brachium, 4.5 the antebrachium, and that's 9% total, 1% for the genitals in general, and then 9% for the lower limbs, front and back. And then children, they have a little bit different proportion because the head is greater than the torso, but they have a similar approach when it comes to calculating the percentages of body surface area. So now for the major types of cancer. So we have BCC, or basal cell carcinoma, that as its name tells you, it comes from basal layer cells. This type of cancer is the most common type, and the lesions looks like a nodule with a crater in the center. So it's easy to recognize. It rarely metastasizes. Metastasis is basically when you have seeding of cancer cells into another area of the body. And this is highly treatable with a surgical removal. Now, for SCC, or squamous cell carcinoma, it derives from the stratum spinosum cells. This is the second most common type of cancer. So the first one is BCC. And then this one looks like scaly plaques that can ulcerate and bleed. And this is found in areas that are highly exposed to the sunlight, like the head and the neck. And this is most likely to metastasize than BCC because this type of cells undergo greater mitosis than the first one. And then this one is still treatable with surgery. Now, we have another type, which is malignant melanoma, in which you have melanocytes that are mitotic. And this is the most aggressive type of melanoma, of cancer that there is in the skin. So it gives you metastasis right away. And early detection, it is needed for increasing the survival of the patient. So it's treated with surgery, radiation, and chemotherapy. And now when someone has a mole in the skin or a birthmark, you have to monitor with the ABCDE approach. So you have to see if the borders of this mark or this mole is asymmetric, if it's irregular, if you have variations in color within the same lesion, and if the diameter gets greater than 6 millimeters, and if you have changes in shape and in color. So risk factor for cancer of the skin: exposure to UV light, smoking, genetic predisposition, being immunosuppressed. So someone who has family history of cancer, skin cancer, they have to have checks, skin checks. So here is basal cell melanoma. It's a nodule with a crater in the middle. The squamous cell carcinoma, it is a flat, ulcerated lesion with these borders that are irregular. And then here we have a malignant melanoma. So this has, of course, irregular borders. It's a pigmented lesion. It comes from melanocytes and is large. Sometimes some melanomas don't have a pigment, so they are called amylanic melanomas. And these are the most aggressive ones that are easily to be detected later on, and then the person has poor prognosis. So then what is the clinical application? Well, you're supposed to be able to recognize the degree of burns in the skin. Also, be able to in a way, whenever, if you go to these clinics where they perform screens for cancer, be able to warn the patients about what are the methods for self-monitoring certain skin lesions that can lead to cancer, and also tell what are the risk factors so that persons can avoid UV radiation and carcinogens like smoking. Other problems of the skin will be infections in the follicles like acne. This happens frequently during puberty, and this is because you have overactivity of these sebaceous glands, and they become inflamed with these bacteria that exist in the skin. And also some people may have tendency to have hyperhidrosis or oversweating. That's normal for some people, but of course we know that it's not normal. And then tissue repair involves either regeneration, so you can have a wound where you have replacement of cells with the same cells, or you can have fibrosis, in which case you can have a scar. And then some people have tendency to have more scarring than others. That's genetics in their skin. Overview for the next chapter. So in the next chapter, we're going to start looking at the bone tissue. So we're going to see what are the bone cells and how they arrange, and then what is the function of the bones. And we will be able to see as well the role in the skeletal system. Test your knowledge questions. Which skin of the layer contains blood vessels and nerve endings? A, B, C, or D? And you can start eliminating answers. That helps a lot when you don't know the right answer. So which one from there you will eliminate first? What is not skin in there? Hypodermis is not skin, right? And basement membrane, is it skin? No. So you eliminate the last two. Then you have the first two. So which one has blood vessels and nerve endings? B. So it's not the epidermis. Remember, I keep telling you over and over again, that's an epithelium, so that doesn't have blood vessels. Next question, sebaceous glands primarily function to A, B, C, or D? B, produce sebum to lubricate the skin and hair. True or false? Thick skin contains hair follicles. False. Otherwise you would be a bear. You will have paws. Okay. So, second, melanocytes produce melanin that protects against UV damage. True or false? Yes. Melanin is protector for UV damage. Next question, the hypodermis contains mostly adipose tissue. Yes. True. Sure answer. How does integumentary system regulate body temperature? Sweat and what else? Blood flow. Okay, very good.